welcome to Local Edition on Time Warner Cable. I'm Steve Swatt with the Sacramento Report. In the next few minutes, we're going to talk about the need for suicide training for mental health professionals. My guest in the segment is Marc Levine, a member of the State Assembly from Marin County. Thanks for being with us.
Thank you, Steve. It's a pleasure to join you.
So one would think that mental health professionals are already trained in suicide prevention and referral and things like that. That's not necessarily the case?
Well, they're trained in many things, but when we look at the rising numbers of people who have taken their lives by suicide, we've learned that a third of them have visited a mental health professional in the year prior to taking their lives, and a fifth of them have visited a mental health professional in the month prior to taking their lives. So it's very important to make sure that these professionals can assess, treat, and recommend treatment to people who are seeking help. There's a national strategy that was published in 2001, and then another national strategy in 2012 that recommended that there is specific training for suicide treatment for these professionals, and that's what my bill, AB 2198, will do.
Before we get into the bill specifics, I guess we ought to say that the suicide rate continues to rise.
Well, it's at the highest rate that it's been in decades, and in the prior 2 years, there have been, in each year, about 4,000 people who have taken their lives in the state of California. It is the fourth leading cause of death for children aged 10 all the way up to adults age 65. It's a very high number. It's too high. Obviously, what we're doing isn't working very well, so we need to change that up and make sure that we can address this issue head on.
So your legislation would call for additional suicide prevention training for certain professionals.
Well, that's right. So for therapists and psychologists, if you're in graduate training, that 15 of those hours would help you assess and treat suicidal feelings. And that if you're already a professional and you haven't had that in your educational program, that you would have 6 hours of continuing education on this issue.
So part of it would be a mandate on the universities to include this curriculum, correct?
That's right. So any educational program that's providing the trainings to the therapists would be able to incorporate this in their programs.
The social workers, for example, and others affected by this, I'm sure they're aware of the need for either better training or a better system, but they are fighting this legislation because it's a mandate.
Well, the numbers cry out for more attention to this issue, and I think everyone recognizes it. There's already defined training programs for issues like substance abuse, for domestic violence, as well as HIV and AIDS. And so this is something that obviously, with the fourth leading cause of death for Californians 10 to 65, worthy of more attention, and definitely shows us that we're not preparing our professionals to address this the way that it needs to be done.
You know, as you and your staff researched this bill, did you find that there were many cases where individuals did in fact commit suicide, and you've been able to trace it back to maybe a psychologist or a therapist who simply did not understand where to refer the victim or what to tell them at all?
Well, that's right. The data shows us that, again, about 1/5 of everyone who has committed suicide has actually seen a professional the month prior to taking their lives, and a third in the year prior. So we know that there's an opportunity to help them, and we want to make sure that everyone has the best training possible to make sure that we save lives, and of course that the people that we care so much about get the treatment that they need.
All right. Well, I know your bill is already out of the Assembly, pending in the Senate. We'll certainly watch its progress with interest. Assemblyman Levine, thank you very much for coming by.
Thank you, Steve.
And thanks to our viewers also for watching Local Edition on Time Warner Cable. A reminder, you can see this and other interviews on My Government On Demand, also on YouTube. Have a great day.